very much, Wendy. As she said, I'm a diagnostician or veterinarian at the Department of Agriculture's Diagnostic Laboratory in Raleigh, North Carolina. And because of my interest in fish, I get to see all the fish cases that come through. And of course, what I'm doing primarily is necropsies or postmortem exams. So I'm hoping this presentation will give you some more comfort if you have started looking at fish, or maybe will give you the confidence to start looking at fish and taking them in as sick calls. Perhaps you've been in a situation where you've gotten a call about taking a sick fish or looking at one, and maybe your heart starts racing. Maybe you say to yourself, well, how in the world do I do this? What should I look for? What tests can you even do with a fish? And what about that water? Maybe you've even said, well, what's the value of this? And someone will actually pay me to look at their sick goldfish. And so I'm here to say that, yes, there are many established procedures for doing physical exams on fish and some diagnostic testing on live or dead fish, and there certainly is value in these fish patients. So the next question then comes to, do you go to the fish or do you bring the fish into the hospital? And to be truthful, that really depends on the situation. For pet fish, certainly it's easy to bring in somebody's little goldfish or tetra and bring it into your hospital. It's pretty simple to set up a hospital tank at your hospital. An aquarium situation, a public aquarium, it's better to go there. They're going to have their own hospital facility typically. Research facilities and aquaculture, they also need veterinarians, and it will be better if you go to their place so that you can see everything that's going on around, not just this one tank of sick fish. Pond situation, again, if you go there, you do have the advantage of looking at the whole situation, the filtration, how much sun do they get, what's the quality of the water, but at the same time, there is advantage to bringing some of those koi into your practice and setting up a hospital tank for them. Dr. Lubar, who is a veterinarian from NC State, is a North Carolina State University, that is. He has written up an article about fish anesthetic delivery systems, so if you wanted to get into surgery kind of things or radiographs, you could look through you could look at that article and get an idea of how to set one up in practice. So now you decided to do fish diagnostics. What does that entail? Well, some of it's going to be similar to what you do for any of the other animals that walk through your door, but there's also some unique aspects. Of course, clinical history, believe it or not, can be very detailed, even on a tank of tetras and goldfish. Water quality analysis is something unique to our fish friends, and it requires some testing done at the practice or at the pond side. Physical exam can be done. There are several tests you can do ante-mortem, and then obviously there's a need to do necropsies too. And then you can submit samples to various laboratories. So clinical history. The history is still the most important part of a clinical examination as it would be in other animals, and the process is similar. The first question I usually ask is very open-ended, such as what's been going on with the fish, which then encourages the owners, in my opinion, to start talking. And as they're talking, I can ask more specific questions and get an idea of abnormal behavior, skin or eye lesions, and then follow up with more specific things about the severity and duration of the problem. So in fish, there is behavior. They're not just floating and swimming around from one side to the other. Abnormal behavior can be things like flashing. So if there is a irritation on the skin, they will kind of bump up against objects in the tank or the pond and to rub against that object, and it kind of gives you this flashing look to them, and that's usually indicating, again, some kind of irritation like a parasite infection. Piping is used, or use that term when they're piping, which is when they're gaping up at the surface of the water, often an indication of decreased oxygen in the water, maybe anemia or gill damage from bacterial or parasite disease. Circling and whirling, again, can be an indication of blindness or neurological disease. And abnormal posture in the tank. Are they just aimlessly wandering around without really not making any movement on their own? Are they sitting there with their head down and the tail up, or vice versa? Are they upside down, perhaps, and they don't have an ability to maintain the proper buoyancy? And then do they have skin lesions or eye lesions, reddening of the skin, darkening of the skin, spots, bumps, ulcers, frayed fins, all those things you need to ask about. And then for how long has this been going on? And once you have an idea of what's going on with that fish, then and how acute or chronic the problem is and the range of clinical signs, then I move on to the questions about husbandry and water quality. So how many fish are in that tank or pond, what kind of fish and the number of fish, how many are affected, which ones, how many deaths are there if there have been any, and have they added any new fish or new plants, and how long ago was that? Especially like with koi herpes virus, you can have fish added the previous fall, and it's not until that springtime when the water temperatures go up that you start to see the transmission and the disease of koi herpes virus, and they may not think back all the way to the fall, so you need to ask that question. You also want to know the size of the tank or the pond, how long have they had it set up, what kind of filter system do they have, and do they have anything extra like a UV light or protein skimmers. If they're bringing the fish into you, you might ask them to bring you pictures of their tank and the filter so that you have a better idea of what's going on. Water quality, that's a big one. Obviously they're living in the water all day long, and so the quality of the water is extremely important. So you want to ask them about water changes, how much water do they change, how often, what do they check for as far as all those little test kits, what parameters do they check, how often do they do it, do they only do it when there's problems, or do they do it on a regular basis, and then be sure to get numbers for them, because I've gotten caught by going along with them when they say it's low or negative, and I assume that means truly low, but their idea of low and my idea of low turned out to be a lot different. So you do want to get numbers from them. Also check on the water temperature. You want to be sure that these fish, this particular species of fish, is being kept at the right temperature. And then of course treatments or questions about nutrition and questions about treatment. This is really important because a lot of times they've already treated themselves, they've gotten salt perhaps in the tank or pond, perhaps they've gone to the store and bought all kinds of over-the-counter things, and maybe the salt actually was working and had removed a bunch of parasites off the fish, but they're bringing you this fish because it still has skin lesions, or maybe now he's septic from bacterial infection, and if you go and look for parasites and you don't see them anymore, you might get confused as to what's going on. And so you do want to know if they have been treating, if it's been working, or if it hasn't been working. So some of these questions may not be something that you are familiar with. It may be a little hard to remember some of these details that have to do with fish tanks and ponds. And so this is an example of a veterinarian who submitted a fish to me, and they have in their computer system these questions already set up so that they just have to type in the answers and they don't have to think so hard about what questions should they be asking. Another idea is you could submit or send a list of questions to the owner to fill out before they come to you with the sick fish, and that might help also with a more thorough questioning. Okay, so water quality analysis. This is a big thing. It's a big topic. We're not going to go into a huge detail because it would take more than an hour to do that. And there's several good books out there with good information that you can follow up on. But the reason why we are going to spend a good portion of time on it is because it's very important, because poor water quality is the most common disease problem of pet fish. It's water quality, poor water quality until proven otherwise, basically. It's going to cause significant morbidity and mortality if the water quality parameters are too far off from normal, or if there's a rapid change in the water quality. If it's more of a low level but chronically bad, then it's going to lead to secondary problems and diseases. So when they bring in that fish, they certainly need to be bringing a sample of aquarium water with them in a separate container. You certainly don't want to use the water that the fish has been sitting in on his way into your clinic, but you want to have that separate sample so that you can use that to test with. There are many, many parameters that can be tested, more than what's on this slide, but these are the ones I think are the most important and the ones you probably have the most trouble with on most tank systems. The specific gravity and salinity we're not going to talk about. The importance of that one is really if you are, of course, a marine tank, or if you are maybe a koi pond and you want to check the salinity level. A lot of the koi ponds will maintain a certain low level of salt in the water for managing stress or when they're moving the fish. And so a lot of them have their own reef